Hey guys, welcome back to my channel. Thank you for liking, commenting, subscribing and sharing my previous videos. And I would like to apologize for taking so long with the Q&A videos. So in today's video, I'm going to merge a video on antibiotics and cold and flu. So on antibiotics, I'll start. What are antibiotics? So antibiotics, these are medicines that are used to treat only bacterial infections. So they are medicines used to treat bacterial infections, fungal and viral infections. So when you talk about an antibiotic specifically for bacterial infections, are antibiotics used to treat all human diseases? No. As I've just said, antibiotics are limited to only bacterial infections like pneumonia, yes, such like diseases. So what is antibiotic resistance? So antibiotic resistance, in simple terms, it means that an antibiotic will not be able to work because the bacteria has come up with like mechanism to kind of fight the drug. An example, maybe I have pneumonia and then I go to the hospital, they test me and then they give me augmentin. So augmentin might not work and I'll have to go for a higher drug in order for it to work because the bacteria has developed a mechanism whereby it's destroying the augmentin, so it will not work. Then why is resistance a problem? So you've been hearing like this week has been all about antimicrobial awareness week. So resistance is such an issue because first of all it will increase the cost of healthcare, in the sense that when someone goes to hospital, I'll just use the pneumonia, then the augmentin does not work, so they'll have to go for a higher drug or a more expensive drug, which means that first of all the person will spend a lot of money doing lab tests to do culture and sensitivity test to determine whether that drug will work or not. Then also in terms of time, it will increase the hospital stays. So if someone is admitted maybe in an ICU setting, then they go and do sensitivity test for the organisms, which means they go and test which antibiotic works for the different organism. You see, it is lengthening the stay of someone in hospital, and then it will also increase deaths because when people have these diseases and then the drugs don't work, it means we'll go for a much expensive drug, and it means that this person at some point they won't be able to afford the drugs, and then they'll eventually die because of that infection. So that is why we are telling you to use your antibiotics wisely. Yeah. And then at the end of the day it will increase infections, because if for example I have a resistant infection, someone else also has it, you see, it's going to spread, and you see many people will have that resistant infection and many people are going to die as a result. Then how do we contribute to resistance? So first of all, not completing the dose. In the Q&A that I did, you'll see so many people say that they don't complete the dose of antibiotics. This is worrying because when you don't complete the dose, you give the bacteria much higher chance to actually fight the drug, so it won't work. Then second, sharing antibiotics. For example, I present with symptoms of maybe a respiratory infection, then my sister comes and borrows me like 2 capsules. You see, we start sharing, and then it means I'll not complete the dose, she'll not complete the dose, so we'll be contributing to resistance. Then self-medicating. This happens when, it happens when someone, mostly patients, go to the counter to demand antibiotics. For example, I have a simple food poisoning. I'll run to the chemist and ask for Flagyl, I'll ask for Tagera. That is not supposed to happen, because these are antibiotics that are used in the ICU setting, and you know what a patient in ICU looks like. It's really not a good position to be. So when you take these antibiotics often, and then maybe that patient contracts that disease which is a resistance, you see, you'll be contributing to the death of the patient. So let us stop buying antibiotics over the counter for common cold and flu. please let us not buy that. Yeah, and then this is for the medics. Fever is not a sign of ceftriaxone deficiency. Please, I know you know what I mean. Then poor storage of antibiotics. So every antibiotics usually come with the label, the storage conditions, be it a suspension, be it an injectable, or be it like a tablet or a capsule. So you're not supposed to store maybe under direct light. So if you store like that, you're interfering with that, and it won't be effective, and that will contribute to resistance. Then how do we prevent resistance? First of all, hand hygiene. So let us always wash our hands before and after meals, after visiting the washroom. Let us observe hand hygiene. Then also cough hygiene. Okay, this is really disgusting. Please, when you're coughing, don't cough in the air because you're spreading your germs or whatever to everyone. Please observe cough hygiene. Then finish the dose of antibiotics. Make sure, if you're told it's 8 hours a day and it's for 5 days, make sure you finish and strictly comply. 3 times a day for 5 days or something. Make sure you finish your dose. Then use a prescription to procure antibiotics. Make sure you go visit a doctor when you have the signs and symptoms. Make sure you go to a clinic, get tested first, then they'll give you a prescription before you run to the counter to demand antibiotics from your pharmacist. Then dispose expired medicines. So how to dispose? Just return to your nearest pharmacy, tell them these medicines are expired. Then when they'll be disposing other medicines, they'll dispose them, because if you throw the antibiotics that are expired in the environment, you're contributing to antimicrobial resistance, and some of these antibiotics are usually very like toxic. So once you take them to the environment, you're also killing other like marine animals and other animals in the environment. So please don't do that. Then on animals, if you're a farmer, please do not use antibiotics to fatten your pigs, to fatten your chicken. No, please. You're contributing to resistance. Only use them to treat the infections. Then vaccination. Okay, we've seen from a while back some diseases like polio have been eradicated, or smallpox, because of vaccination, and this prevents us from using antibiotics. Even when you get the pneumonia like vaccine, it will prevent you from using antibiotics, and you see, we'll be sparing the antibiotics, right? Yeah. Then practice safe sex. Please, if you're having sex, please just wrap it up. That's what I'll say. Then this goes to my fellow doctors. Please explain to your patients that they do not need antibiotics for common cold, common like flu and simple viral illnesses. Just tell them how to manage that without touching on antibiotics. Yeah, so that's it. Then I'll move forward to the Q&A for cold and flu. So the first question was, do you know the difference between cold and flu? So 43% said yes, 57% said no. So I'll just explain. Like, a cold is the milder form of a flu. Both are caused by viruses. Then, when it comes to the signs and symptoms, it brings me to the next question. Do you know the signs and symptoms to differentiate the two? So 44% said yes, 56% said no. So I'll differentiate them. So a cold usually starts gradually. This is what I mean. Today I have a cough, tomorrow I'll sneeze, then the other day I'll have a sore throat. You see, it's developing gradually. And then a flu, it's just abrupt. Like, within an hour, I present with so many symptoms. I have fever, I have aches, I have chills, I have a dry cough. So that is how you'll differentiate. And then some of the common signs for a cold are usually milder or less common in flu. For example, a running nose, a stuffy nose, sneezing, a sore throat, and a wet cough. So when it comes to a flu, mostly you'll present with those symptoms, but they'll be milder or less common, but you'll have fever and muscle aches or body aches. That is how you'll actually know you're developing a flu, and then it will come all of a sudden. And then there are usually those flu seasons For example, from November. So I was saying, have you ever taken an antibiotic for cold and flu? This is worrying because I'm seeing 60% have said yes and 40% have said no. Okay, this could be as a result of the signs and symptoms of a respiratory tract infection mimicking that of the viral illnesses. But make sure you go and do a test in order to differentiate the two. Yeah, so for cold and flu, you don't need an antibiotic because they are caused by a virus. So the thing is, just go get a vaccine for the flu, and then just use the ginger, honey, water and lemon that I said earlier, and then the antiviral medicines that I used to treat flu. So have you ever received a flu vaccine? 19% said yes and 81% said no. So okay, this is worrying, and that is why I think there's a common trend for people taking antibiotics for flu. So there are two places that I know where they offer flu vaccines. One, there's a chemist in Westlands called Health Aid Chemist. It's by Dr. Nadia, a pharmacist. Then there's another one called Portal Pharmacy. You can get it in town or in Two Rivers. So there, I'm sure they offer the vaccine, so you can go there and ask for them. Then how often do you take antibiotics? This is also worrying because the options were once in a while, very often, whenever I feel sick, and with a doctor's prescription. So many of you said very often whenever you feel sick. This is because I think antibiotics are readily available over the counter. But right now, the board is trying to regulate that, and it's illegal to buy an antibiotic over the counter. So to my fellow practitioners, please don't issue antibiotics without a prescription. And to the patients, as I said earlier, don't go demanding antibiotics because it's illegal. Don't put us in that situation where we have to sell for you that. Then, do you finish the dose? Also, this is worrying because only 40% of you finish, the rest don't. I had already told you, please make sure you finish your antibiotics, even if it's Flagyl, the way it has that metallic taste. Please make sure you just finish for the sake of curbing the resistance. Then what are some of the common antibiotics that you buy over the counter? So I've seen someone said Panadol, and I'd like to correct that. Panadol is for pain, it's not an antibiotic. Then amoxicillin, augmentin, azithromycin, metronidazole, and this is worrying because these are some of the antibiotics that I used in ICU setting, as I said earlier. So let us not rush to go buy them, because you see, when we get resistant infections, so many of us will lose our lives, we lose our loved ones, and that is not what we want to do. So in conclusion, please make sure you go get a laboratory diagnosis, go to the doctor, they write you a prescription, and don't coerce the doctor or the pharmacist to give you antibiotics. So thank you so much for this video. Thank you. If you have any questions, please leave them in the comment section. Make sure you share, like, comment, subscribe. Thank you so much. Bye.